All right, it is 19 minutes done past five, and you're tuned into Smooth Health on Smooth 98.1. My name is George Ray, and indeed, you're welcome to Smooth Health. And to be a part of Smooth Health this evening, well, you can come through on WhatsApp and ask your questions. The number is 0809 440 981. You get to ask your questions, and my guest in the person of Dr. Uh, Oluwabusayo Fagbo, she will be attending to your questions. And talking about today's conversation, we'll be talking about mental health, especially in a working environment. And I know that some people usually are wary of talking about their mental health or generally just talking about mental health. There's certain things that are usually associated with it. Some people get to look at you in a weird way, like, huh? Are you sure that everything's well with you? How can you be saying that there's something wrong with you mentally? There's the notion that once anybody has to say anything about mental health, they look at you that you're not all right up there, that you're probably going crazy or something of that nature. But my guest will be talking more about that and also how you can manage stress because we live in Lagos or even as Nigerians and we're experiencing stress one way or the other. But we'll be talking about it from the work environment. So feel free to come through, ask your questions. You can also share experiences as well. But I'd like to say very good evening to you once again, Dr. Oluwabusayo.
Good evening, Joy. Thanks for having me on the show.
Always a pleasure. Okay, so I know that mental health is something that a lot of people, or mental health issues, are certain things that certain people are scared to have conversations about, especially in their workspace. How common really are mental health issues amongst employees today, whether you're working from home or you're working in the office? How common is it? How often would you even expect to hear about someone having mental health issues?
Okay. It will be a disservice to the whole mental health community if I don't even define what we're talking about. Okay,
Right.
so I always start my conversations. It's like an anthem for me by defining what mental health
Please
is.
do. Please
You know.
do.
All right. So it's we keep hearing the slogan, there's no health without mental health, no health without mental health. Because
Right.
really, when the definition that we use is the World Health Organization definition mental mental health and of health.
Right.
It defines health as a state of physical, mental,
Mental.
and
Yeah.
social well-being, not just the
Right.
absence of disease. So when you say there's no health without mental, literally in that definition, there's mental there, physical,
Sure.
mental, and social. I hope I've not
Mhm.
confused anyone. Now, so when you're not talking about mental
Right.
health, you're talking about anything that pertains to the mind health. People always point to the brain. Okay. Now,
Right.
the definition is like a state of well-being where individuals, me and you, now I'm talking about in the workplace. Workplace is any location, anywhere. Now we have a lot of remote workers, physical
Mm-hmm.
and virtual, where you engage in, it can be professional employment, can be in health,
Mm-hmm.
can be in school. That's the workplace. So we're
Mm-hmm.
not talking about the person's well-being. Now, when you're talking about the definition of mental, I'm talking about the state of well-being, where the individuals realize their own abilities. Their own
Mm-hmm.
abilities as per, I'm a teacher, I'm working in a school. Now,
Right.
this teacher now is working in a workplace, the school, right? Now,
Mm-hmm.
I can cope with normal stresses of life, including the workplace stress that I will be talking
Right.
about more this evening, and can work productively in that workplace.
Mm.
I don't know, maybe you're getting what I'm saying.
I do. I
Because
do.
if you can't work productively at your workplace, then you
How
have
else
not
are you going to?
satisfied the definition of mental health.
Right.
Because when you're talking about mental health and mental illnesses, there are two things. They are different. You
Thank you
might
for
not,
clarifying that.
yes, because you might not, your mental health might be suboptimal, and yet you don't have a mental illness. I don't know, maybe I get
Right.
what I'm saying.
Yes, indeed.
You can be under intense stress, but you don't have a diagnosed mental
Mental.
illness.
Mm-hmm.
So, and the last statement in the definition of mental is that they can contribute to their community. And we're talking about the work community here. Now, to the
Right.
question that you asked me, you said, how common are mental health issues among employees today. The truth is that we have, paucity of data in Africa and Nigeria. However, the World Health Organization, when they did the research in 2019 globally, about 15% of people working have been estimated to have mental disorder. So this is not a joke. People come down with mental illness at work. And I can tell you that in the last 1 month, working in Nigeria, I've found a lot of people walk into my clinic as a result of who broke down, who came down with mental disorder, primarily from stress from work. And may I tell you, I won't mention the particular bank, but they were majorly from banks. And this, I've not done any research, please. And I'm not trying to, I don't want anybody
I understand that.
to take me to the court or anything. This is just what I've seen. And two things were very common. Is the excessive workload, the target, and they're understaffed. We have people coming down with mental illness. It's more now.
That's actually alarming.
15% of people. That's a lot.
That's actually a lot. If you have that small workspace and then you're having 15% of the individuals in that small working space coming down with mental fatigue, then indeed we have a lot. I don't want to alarm us, but kind of seems like we have a pandemic on our hands in that aspect.
I agree.
But now let's even talk about the things or aspects that we can actually deal with. And when I'm talking about aspects, I'm talking about in the workspace. What are some of the most common conditions that one would experience that would make one say, okay, I think I'm coming down with a mental health issue and I need help? What are the signs that we're looking out for? Or is there a way, is there something to actually, is there a symptom or some way one can actually figure out?
You're talking about the signs and symptoms, if I get you right?
Yes.
Okay. Now, while I was trying to define mental health the other time, one thing that is very key for us is an individual's functioning.
Sure.
The personal functioning, the occupational functioning, the functioning at home, the family, and within the community. Right. Now, when we're talking about for the workplace, we're talking about the occupational functioning. When you're talking about occupational functioning for the workplace, is this person coming to work regularly? Because when somebody is, there's increased absenteeism, which is unusual. Those are things that you see, and you're like, oh, this person is not doing well. Or someone is coming to work and is not doing what's expected at work. You're giving the person, which is something that the person does regularly. It's about a change in the usual of that individual. We have a range of things, a range of symptoms. But first thing that you must know is that usually when it comes to mental health symptoms and signs, for some of it, the individuals experiencing it cannot say. It's people around them. It is behavior that will say, oh, doc has changed. This is not the way for me does the stuff. They start forgetting stuffs. Now when it comes to the real symptoms of mental, like as I said, oh, is the mood. Changes in mood. Because one thing I must quickly add here is that we have a lot of mental disorders, but there are some that are commoner in the workplace from research. Depression and anxiety disorders are often commoner in the workplace.
Right.
Now, so these are so signs and symptoms are related to these are things that you find. The mood is changing. Is it that the person is sad persistently, which is not the usual of the person? Or the person tells you they're having mood swings. They are just irritable. Their performance is decreasing.
It's decreasing.
They are keeping to themselves more. Coming to work, not greeting. You can count. They're just relating monosyllabically. Social withdrawal. Extreme fatigue sometimes.
But could there be a reverse in that kind of behavior where naturally this person's is usually reserved, all of a sudden the person is boisterous? Could that also be a thing as well?
Thank you very much, Joy, for saying that. I was coming to that. I said depression and anxiety are like the commonest, but we have other mental health disorders. We have schizophrenia, psychosis. We have bipolar affective disorder. That's
Right.
like two poles where you can have a patient with the manic face, and in that face, when the patient has the manic, or mania, when we call it mania, that's when a patient can tell you, undue elation. They are usually happy, which is not in keeping with their usual health. Now, one thing
Mm.
you have to understand is that everyone coming to that workplace is a member of a particular family, as a gene. Do you understand what I'm saying? Now,
Right.
one of the most important factors when we are
Mm-hmm.
studying people with mental illness is that we ask you, is there a history of mental illness in the family? So you don't know if your coworker has a prior history of mental
Mm-hmm.
illness in their parents. Now,
Okay.
usually this could run in families. I'm not saying that it's everyone who has a family history that comes
That
out with mental
will have that.
illness.
Mm.
But what
Mm.
I'm saying is that they're already predisposed. So now when they now have excessive stress from work,
Right.
it can now make them break down further. I don't know, maybe you get what I'm saying.
Okay. I do understand what you're saying there. And that is something that indeed, we will be talking more about effectively and addressing. I know that this conversation is not going to be so quick to just shove to the side because most people are usually scared to talk about their mental health. But we're going to have that. We're going to talk about how it is we can approach mental health, especially in the work environment. Whether we should even be talking to our, bosses about it or not at all, because some people feel that the minute they open their mouth and talk about their mental health, they will be deemed to be mentally deranged and so much more. But we'll talk about that on the other side of this quick breather. Lagos, don't go nowhere. Stay tuned to Smooth 98.1. I even have a question here, but I will take that on the other side. Someone's asking uh something that I relating to his mental health. Or like I said, we'll take that when we get to it. Because he says it's not only bankers, telecom engineers as well are into that space because they have so much deadline that they have to meet up with. So their mind is always fogged and constantly trying to figure out how they're even supposed to survive in the first place. But when I mentioned talking about it from a work environment, there are reasons why I said, you know what, we talk about it from health angle on a general note, but we never talk about it about from the work environment. And it seems like usually hush hush, or we're afraid to talk about it in general. So it's actually great to know that okay, people can relate to this and are not afraid to express themselves as well these days. Normally, when you hear mental health, you're like, are you sure everything is fine with you? Or as the Gen Zs now, they say that they're just using it as a way to cop out of doing certain things. All right, let's get back in. All right, it is 32 minutes gone past 5. You're tuned into Smooth Health on Smooth 98.1. My name is Joy Ray, and this evening, my guest with me talking on Smooth Health and about your mental health is in the person of Dr. Oluwabusayo Fagbo. She is a mental health specialist, and she's been giving us insight and things to look out for, especially when it comes to your health in a working environment. Certain people suffering from depression, anxiety, and sometimes schizophrenia. But, that is on one side of the divide. But now let's even talk about, mental health and probably your employees. I want to know really at what point in time can one start talking to their employees or employers rather about mental health, even from the employer angle. How do you start to broach conversations without making people feel that you're singling them out? Maybe you've noticed as probably someone in the HR department and you figure that this person isn't all there. is not as active, like you actually pointed out earlier on, that this person is no longer as active as they used to be. So how can they also broach conversations around this without making it look as if the person isn't altogether there?
Thank you, Joy. All right. So the truth is, I've seen a lot of companies do this. Yeah, even in
Okay.
Nigeria. Yeah, companies with even before it depends on the company and
Okay.
how their structure is. There are some institutions and companies that even before you are employed, you are
Okay.
sent
An evaluation.
psychological evaluation at psychiatric hospital. Do you understand what
Okay.
I'm saying?
Right.
I've had to speak to people before and then you as a psychiatrist will have to write and sign that, oh, this person is fit to work here. Do you understand? So even
Right.
some organizations that have years that they do that. I've seen that
Mm.
happen. However, like I said, one thing that I see that I know a few companies are beginning to get into it, is to, put it in their CSR, their CSR initiative to train their managers, train their supervisors, and even the workers on mental health literacy.
Right. Right.
Yes, there should be quarterly, monthly, depending on the kind of, work. Because the truth is, different workplaces experience workplace stress, and it depends. Although most times we hear that, oh, places like health sector, you know, places that have emergencies,
Mm-hmm.
those kind of places have more problems.
Trying
You
to
understand?
be. Yeah.
However, at every point in time, be it as you are starting the job, you should have an evaluation. When you just
Mhm.
like when you were asking me about symptoms the other time, when you start
Right.
noticing this, it's just as a manager, that's why the training is important. And that's the reason why this kind of you know, talk this kind of talk from Smooth Health is a very good one, because I'm sure a lot of managers and even workers will be listening to it. Companies
Indeed.
have to add this to their yearly plan to invite
Okay.
psychiatrists. We do that at Mind Bob Health. We train, we train managers, supervisors, and even workers on mental health literacy on how to
Okay.
recognize the symptoms early. Do you understand what to do? And something that's very important, because just like you said, yesterday I was having an interview. I was talking about psychosocial
Yeah.
disability, psychosocial
Mm-hmm.
disabilities, you know, and it was all around stigma, public stigma, and all that.
Mm-hmm.
How do we protect this person that the people in the office will not be stigmatizing them? It all starts from the education of the
Right.
workers and the trainers. So once, in fact, it happens, they keep sending them in, especially those that are registered with HMOs. I see companies whose staff is registered with health HMOs. They send them in for
Okay.
evaluation. When they notice that, oh, this person is, yes, they send them with a letter, and we do that. Do you understand what I'm trying
Mm.
to say? And for some,
Yes,
we just
indeed.
say, oh, it is high, it's just high level of stress. This person just needs to sleep. Do you understand? This person just needs
Mm.
some extra days off. So
Okay.
when you start noticing changes, then another thing that we'll still get into is the one that is even more serious. Most of the workers medicate their symptoms with hard drugs, substances.
Ooh.
Some you can call it socially acceptable psychoactive substance like alcohol, but it's still a psychoactive substance that make people come down with mental illness. Some people
Okay.
have to take stuffs before they can walk. Now, and the thing about this is that even though this is now high, you don't know when to the truth, they are addictive substances. You don't know
Indeed.
when, you know, because
Your
it's
body
like
now gets to absorb it
you're
so much
addicted
that
to
you
it.
don't know that you're addicted. Yeah.
Not just that, and because these substances can predispose you to mental illness. I don't know, maybe you
Mm.
understand. So then it gives it
I
a
do.
vicious cycle.
Okay.
You're now coming down with psychosis. When I mean psychosis, distortion
Mm.
in behavior and all that, caused by alcohol, caused by things like cannabis.
Mm.
You understand what I'm saying? Or other stuff like tramadol. Some use tramadol just to give them strength and all that.
To
I
boost
see a
the
lot of
energy at that point in time. Yeah.
I see a lot of
Mostly factory workers.
factory workers abusing tramadol a lot. You understand?
Mm.
And this substances have serious withdrawal symptoms that if they don't take it, it will look like they're in emergency situations. So when you begin to see things that are unusual, especially coming from changing mood, or a worker is not coming regularly, it's asking
Mhm.
for frequent, it's just absent at work, poor performance, the mood is down, or it can go as bad as incoherent speech. You are saying this, the person is saying this. And sometimes the incoherence is even noticed in what they type at work.
Right.
Yes, when it gets to the extreme cases, start typing wrong letters and all that. Then, just like you said, if there's proper training at work, there won't be stigma. I don't know, maybe you understand. Once you identify this stuff, you don't need confidentiality is so important because it will allow people to access help.
I agree with you on that. Well, when it comes to confidentiality, just trying to make sure that you're in a safe space. You're not going to be trampled upon. Nobody's going to take your specific case and share it with the rest of the workers. Then you're able to just share what it is you need to share and not be afraid. And indeed, you will be fine. But come to think about it, talking about work stressors, I know you spoke about one being tied down with so much work and then shortage of staffs. What other signs can one actually look out for? And how can that also contribute majorly?
There are a lot, but let me just give you some,
Okay.
I've mentioned excessive workload. Also the hours. Some jobs have inflexible hours where, they call it 9 to 5, but these days it's like 7 to 8 in most organizations.
Right.
The inflexible hours. Maybe some managers and company owners have to understand that for you to have good productivity, you have to consider the well-being, including the mental, financial, proper job remuneration. I must pause to say that work is not bad for mental health. Decent work is very, very good for mental health.
It's important to be honest.
Decent work is very, very good for mental health because it will make you have a sense of livelihood. It gives the person confidence.
Right.
I get what I'm saying. And when you go to work, it's like a social place. You have positive relationship.
Indeed.
You feel like you're included into a community.
I agree with you on that one.
Then routine is good for life. You cannot just wake up and then there's nothing to do. Routine and a lot of benefits. Some people get their life partners at work. Okay.
Sure.
A lot of things. Some people get connected to various things, various other opportunities at work. So what am I saying in essence? So that I don't fail to say that work is very good for mental. I said occupational functioning. Meaning that if I'm clerking a patient and the person doesn't have any unemployment is a bad prognosis factor. The prognosis is bad for somebody that doesn't have any work. Do you understand?
Right.
So now back to your question on the risk factors that are commonly found in workplaces that can predispose people to mental health. Now, which is actually common also here in this part of the world, where the job description is not clear. One of my patients came in and then and then a sister, I was telling them because because it gets to a point when some of our patients they've had several relapses. So they're not usually motivated to do things. So rather than waiting for them to say, "Oh, can you think of what you want to do?" No, I will help them in choosing something. Go and start something.
Okay.
Are you getting what I'm saying? So she got a particular job and she was like, she's supposed to be a lab, something. Then the boss's wife will come, send her to the market, buy.
Oh my days.
Those things can be very, very, it can cause a lot of pressure. But it's commoner in our culture. So that they will not even give you it's very rare for you to find a job giving you a clear job, bro. They will even give you the job, bro, and they will exit. That's one. Then when the place is not conducive, poor physical working environment, the place is so hot.
That itself is another problem entirely. Starts to affect your productivity.
Those are things that can cause it.
Right.
Now, I'm thinking that all these very long hours, maybe we need to start looking. We need to start looking at shift jobs all around for all work cadres. Maybe we need to come back to that now, so that staff we know when they have to when to rest. I don't know. Maybe you get what I'm saying.
I do.
Because we need to look at the job hours, inadequate pay.
That's another issue.
Even saying that there's no pay that's actually enough. And
Right.
people say, people say that money is motivation. You know,
It can
inadequate
be.
inadequate pay is a major problem. And then you see a worker who say, okay, I'm going to work. They'll calculate the distance they'll trek and then take another cab. Physical stress will also lead to mental stress.
Right.
Then when you have a very bad boss, that's what
Mm.
I've had somebody walk into me and I was just trying to convince her, but you don't have another job. She said, Ma, my
I'd rather be
my
home than
madam,
work with my
my
boss.
madam is my work, is my stressor. She was
Oof.
crying. Because the truth is that we're still coming to how to cope with stress, right? And
Mm.
avoidance is one of the coping mechanisms. When you want to cope with stress, avoidance. So I wait for. I didn't want her to lose that job. I said, "Wait, can you just stay there until we get another job?" She was crying. I was like, it shouldn't get to that point. So when you
Okay.
have authoritarian supervision, we have to be authoritative, not authoritarian. You need to include your workers. You need to understand. I get
Who
what I'm
they
saying.
are.
What they are facing, because you are just there. You are up there. You're not down there. You don't know what they are going through.
Mm-hmm.
So authoritarian supervision is one of the things that put people so much pressure. I've had to work in a place where there was a lot of workload. But looking
Oof.
back, I still enjoyed the work because I liked my boss so much. You're just there, you're still happy. You don't even know you're working. So relationships are important, positive relationships. You know,
Positive
as a
relationship.
as a supervisor, check on your workers. Not just it's just
Mm.
about work. You have to understand what is happening. How's your wife? You might not mean it. Like you might not be like deep.
Like in depthly, but you know, don't just ignore them
You get,
in all.
it's stuff is saying, oh, my wife,
Yeah.
I came late because my wife is pregnant, and you didn't hear that part. There's a way it is. You didn't hear that.
Mm.
You're not human. Are you getting
Right,
what I'm saying?
right,
It's your
right.
work. If you want your work to be if you care so much,
Invest
one
in the
thing
people as
I
well.
think I was in one of these global summit leadership conference earlier this year. And one of the things that is important is about how you take care of your workers. One there was a particular company, I can't remember now, and the speaker was saying that when the boss concentrated on the personal life of their workers, whereby they
Right.
ask about them, check on them. You know, it's weekend, it's not work. Go to their house. When they build
Okay.
relationship with their staff, it
Mm.
translated into better productivity at work.
All right. I agree with you
Now,
on that
or
one.
underuse when the person feels that their skills are not being used at work, is also a stress.
Mm.
Discrimination, especially when it comes to gender roles here in our culture, whereby I see people come into
Patriarchal
my office
society
and you're
that we
like,
live in.
I'm telling you real life cases. My
Okay.
patient is stressed because when we're talking about mental health at work, we're talking about people that don't have mental disorder and people that have mental disorder that are also working. Because
Right.
please, my patients have the right to work. That you have mental illness doesn't mean you should be denied a job. Because
Right.
I was telling you that earlier, earlier yesterday, I was still talking
Mm.
about psychosocial disabilities because this is also a problem where our patients are stigmatized, they don't get job, and there's so much social exclusion for them. So when I'm
Mm.
talking about mental health at work, I'm talking about for people that are at work that don't have mental illness, and for people that are at
Right.
work generally that have mental disorders. I don't know, maybe you understand that
I
you have a
do get
mental
it.
disorder doesn't mean you can't function at work,
You
and
can actually
that's
function.
why we're having this talk, right?
Right. Indeed. One
Then
of
the
the
other
things
one that I must not fail to
I wanted to
mention.
chip in. I know we're out of time already, but there's something I wanted to quickly ask, and I'd like your response in a minute or less. And this has to do with, how you're speaking about the subordinate that those at the top brass need to talk to or need to look out for their subordinates. What about the subordinates also looking out for the top brass? Because they too don't know what the ones at the top. It might be that the employers are also going through theirs. How do you also manage that relationship?
Thank you, Joyce. And thank you, Joy. The truth is, Look at it, Joy. If your employer is not the truth is, I've worked in several places, so I can use my
Right.
life as
An
as a
example.
as an example. I've had a very
Mm,
difficult boss, but I tried to penetrate the boss. But it's not
mm,
everybody that has my kind of personality. I'm
okay.
bold. I'm going to talk to you. My boss, I had one boss, and then we eventually it became so close that it's one of my mentors now. Do you understand?
Mm,
For
awesome.
an employee to be able to look out for their employer, the employer has to be a calm person. I don't understand. I don't know, maybe you get it's so that don't look as if you are overstepping your
Your
boundaries.
space, yes.
Now, Joy, I forgot to let you know that one of the major things that causes problem also at work is violence and workplace harassment. I
Right,
forgot to say that
right.
workplace violence, it can be physical, it
It
can
can
be from
also
the
be
co-workers,
verbal.
it can be from the whoever they're providing service to. I've had
Right.
somebody come and slap my patient. You understand? In a telecommunication company, and this landed this lady in my on my in my clinic. Physical abuse at work, verbal and sexual harassment from bosses, just because they know that
Mm,
these girls need money and they want to. I don't know. I'm sure you understand what I'm saying.
I
These
do
things are
understand that.
stresses. These things are
Well,
stresses.
we could
You know.
go on and on and on. There's so many aspects that sadly we can't touch this evening. And but I do know that Lagos has actually learned a thing or two. I'm hoping that we can actually come back to this conversation. We'll schedule another day to have this conversation and look at more as aspects that we can touch on. But how can Lagos reach out to you on your social media handles? Twitter, X, yes, Instagram.
All right. So yes, we have a psychiatric platform also, and then I'm on Instagram. Mind Bob with Doctor Boosting. Mind Bob. Mind MIND Bob
Yeah.
BULB Doctor
Okay.
DR _boosting BOOOSTON. I'm also
All
called
right.
Doctor Boosting. So that's how you can reach out to me on social media. When you go to the Instagram, you'll find the linked tree, and then it will just take you to the telepsych. We have a telepsychiatric platform where we help a
Right.
lot of people. We have hotline where we do a lot, and we also do training for
As well.
companies. I even have one next week somewhere on the island. So we also
All
do
right.
this because this is very important and germane. Because once you know how, we train you on how to support your worker in open
You.
communication, active listening. You understand mental health literacy generally, how to recognize these symptoms and what to do as the
When
manager,
it
what to do
happens.
as a worker to your how to look out for your
For your
co-worker.
prospective worker as well.
Yeah.
Ah, thank you so much for all that insight this evening. And I'm sure that there's so much more we will get into. I definitely will reach out to you so we can have a second part of this conversation and look at more in-depthly how it's not just talking about the mental health within the workspace, but also seeing how employees can also seek professional help without having to be stigmatized because we didn't touch so much on it, but we'll definitely talk more about that. But I also want to say a very big thank you. And indeed, I hope you have yourself a pleasant evening and, well, start to a weekend already because it's Thursday.
Yeah.
The weekend is just around the corner. All right. Thank you so much, Dr. Oluwabusayo. I trust